Hi, welcome to Hey Doc with me, Dr. Katie. This is Symptom Checker. Before we move on, remember to smash the like button and to subscribe. In today's episode, we will be talking about the symptoms of endometriosis. Endometriosis is a condition characterized by the presence of tissue found in the inner lining of the uterus. Classically, when this tissue is found outside of the uterus, it is in the pelvic regions around the ovaries, the fallopian tube, and at times around the intestines. It is a very common condition, and in the UK, it affects 1 in every 10 women. The risk of developing endometriosis is higher if there is a family history of this condition, especially if this condition affected the mother or the sister of that individual. The pathological nature of this condition means that women are affected mainly in their reproductive years. However, it may persist as a chronic condition and affect women even beyond their reproductive years with chronic pelvic pain. This happens especially when endometriosis is severe and was never treated. The precise origin of endometriosis remains uncertain. However, we know that it's very closely linked to hormonal influence. Similar to the endometrium that is found within the lining of the uterus, the same endometrial tissues that are found outside of the uterus also react to hormonal fluctuations, and this can lead to menstruation happening outside of the uterus itself. This menstrual bleeding that happens outside of the uterus leads to discomfort, inflammation, and formation of scar tissue, potentially causing long-term harm and damage to the pelvic organs, which is the reason why some women who suffered from severe endometriosis during their reproductive years continue to experience chronic pelvic pain even in their menopausal years. Now, let's go into the symptoms that you will observe if you have endometriosis. The first symptom that almost every woman with endometriosis will experience is pelvic pain. For those with severe endometriosis, what will tend to happen is that before they actually start a period, that means before there is actually a blood flow, these women will experience pelvic pain that feels like period pain, starting anything from 1 week to a couple of days before menstruation actually manifests. And for those with a mild to moderate form of endometriosis, they will experience pelvic pain, which many women refer to as period pain during menstruation. And so these women may not actually get period pains before the bleeding starts, but only experience these period pains whilst bleeding. And just because you are not experiencing these severe pelvic pain before the menstrual flow starts doesn't necessarily mean that you do not have endometriosis. Some women, usually those with a severe form of endometriosis, they will have constant dull ache in the pelvic area, irrespective of whether or not they are on their periods or close to having their period. And the final thing to say about pelvic pain is that for those with endometriosis, the pain that they experience during their menstrual flow may get worse with time. And this may be indicative of the fact that the condition is progressing. Painful intercourse. Now, this is very often not associated with endometriosis, but actually it is an important symptom and sign of endometriosis, especially the type of pain that happens during deep penetration, painful bowel movements, or painful urination. These symptoms are seldom associated with endometriosis. But once you have experienced these symptoms for a prolonged period of time and you and your doctor have ruled out other condition, it is important for you to consider whether this might be endometriosis. Painful bowel movements or painful urination that happen especially during your menstrual cycles may be signs of endometriosis. Heavy and prolonged menstrual bleeding. Then we have the frustrating infertility. Especially when it is extensive, endometriosis may stop you from getting pregnant. Severe pain and discomfort during ovulation, also known as Mittelschmerz syndrome. And finally, we have chronic low back pain. When we think of chronic low back pain, we often do not relate it to anything to do with the female reproductive system. However, this chronic low back pain in young women without a history of trauma or any form of injury that could have triggered this low back pain should make you think, could this be a symptom of endometriosis? That's it for another episode of Symptom Checker. Thank you so much for sticking with us right through to the end. And before you leave, remember to smash the like button and to subscribe. That will help to support the work we do here on Hey Doc. We look forward to seeing you in our next video. Take care.